Welcome. It's good to see each one of you here tonight, as well as each one of you joining us virtually for our third session in 30 Days to Natural Diabetes and High Blood Pressure Control. It has been an exciting journey. Many of you are interacting with us. We've got a lot of great questions that we want to answer this evening. But before we get into all that, I have to tell you we've got some loose ends that we're actually carrying over from things that you've asked in previous sessions. So tonight we're talking about this important question: are there shortcuts to better health? Are there shortcuts? And you might say, well, it depends what kind of shortcuts someone is looking for. One of the ones that has been alluded to in some of the questions that we've been getting is, well, should we just dump our prescription drugs so that we can adopt natural supplements? Is that really the strategy? When we speak about a natural lifestyle approach, do we need to be getting rid of all those prescription pills? Well, let me tell you, first of all, don't stop abruptly medications, especially high blood pressure drugs, because we have seen literally nightmare scenarios when people actually stop drugs without medical supervision. There are some medications that can cause what we call rebound hypertension, where your blood pressure goes up higher than it's ever been before. There are other drugs, if you stop high blood pressure drugs, that can actually trigger a heart attack. So please be working with your providers. But you say, but I want to do things naturally. Well, that's what this whole program is about. But let me make an important point. When it comes to both diabetes and high blood pressure, I've been doing this for a long time, there are no supplements that are as powerful as comprehensive lifestyle changes. So the focus, the foundation of this program is lifestyle, but we are going to be talking tonight about some supplements. Some of you have been asking about some, and we've got those in our presentation tonight, answering your questions, but we're also going to be taking some new questions that have come through to us. Well, if you're just joining us for the first time, or if you're one of those folks who've written in, you say, I can't find the handouts, we're projecting it again for you this evening. Simply go to fortwayneadventist.org/30 days. That is the landing page. That will take you to all the weekly handouts. We've got them from previous weeks. And you will also find these live sessions archived there. So all of those are available to you, fortwayneadventist.org/30 days. For those of you in the house, you've all gotten your handouts, haven't you? Is anyone still lacking a handout? Does anyone need one? Okay, it looks like we've got a great job of folks greeting you at the doors, and you've all got handouts in hand. Now, if you go to that landing page, I just want to walk you through it. If you haven't been there lately, that will take you to the daily videos. I know a lot of you, like me, are getting the texts, and you get that daily text, you just click on it. Well, where is that taking you? It's actually, you could just as well get to those videos using the landing page. And you can just scroll down, and you'll see them in reverse order. So day 13 should be showing up there. Actually, day 14 today. I took this screenshot the other day. And then you've got day 12, 11, 10, etc. So every day a new link goes on the landing page. And if you've signed up for text alerts, you're also getting them that way. If you scroll down below the videos, you'll see the handouts. Here we are at session 3. Are there shortcuts for better health? 3 different handouts. So one is the overview for tonight. A second has some of the color illustrations that are actually taken from the Kindle edition of 30 Days to Natural Blood Pressure Control, the book. The Kindle edition actually has color illustrations, whereas the print edition just has black and white. If that sounds interesting, there's some rationale for it. And then you've got a set of recipes that we'll be talking a little bit more about. So with that background, let's go to the resources, because we've got some of your questions that are being answered here about supplements. Again, the reason to use supplements is not a shortcut to avoid making lifestyle changes. Remember, lifestyle is the foundation. Supplements can be adjuncts. They can be things that you can add on to give you some additional benefit. I want to talk with you first about a concept that's called the therapeutic window. In this illustration, the white portion of the diagram represents the window. So in the illustration to the left, you see there is a medicine. Now, let's say you're taking a medicine. In fact, just give you a very pertinent illustration. Right now, I've been dealing with a patient in my telemedicine practice who is on warfarin. That is a blood-thinning medication. And he's been having some trouble adjusting his levels. There's a number of reasons for that. But warfarin has a narrow therapeutic window. That means if you go too high, you can get toxic. If you get too much warfarin, you can bleed. Okay? And below it is ineffectiveness. That means if you don't get enough of the warfarin, it won't do the job of thinning your blood. So this fellow is dealing with these challenges. So toxicity and ineffectiveness. Narrow window means there's not a lot of wiggle room. You've got to have a pretty precise dosing of the medication. This is also true of HIV medications, okay? It's true if you have a transplant, anti-rejection drugs. Now, there's other medications that have a wide therapeutic window, as is illustrated there on the right. And what does that mean? That means simply that even if you vary the medication's dosage a bit or even quite a bit, it may not cause any problems and still may be effective for you. Now you say, what does all this have to do with supplements? When you take a supplement can affect the metabolism of a medication. So there's stories, documented stories. Someone has a kidney transplant. They're on drugs to prevent the rejection of the kidney. They start taking a supplement, very well-meaning, and it changes how the body deals with that drug. The drug effectiveness decreases, and they lose their kidney. Okay, you get the picture? So here's the point. The point is, even if the supplement is well documented to be beneficial, if you're taking other prescription drugs, consult with your physician and or pharmacist, your provider, your pharmacist as well. Why? To see if you're taking medications that have this narrow therapeutic window where it could be dangerous to add even a beneficial supplement. Fair enough? So that's one of our ground rules. Now, it was asked last week, are there certain supplements that are particularly dangerous for high blood pressure? This is a list taken right from our book, 30 Days to Natural Blood Pressure Control. And I want to walk you through about a dozen. Actually, some of you who can count well, you'll say it's not about a dozen, Dr. DeRose. It's exactly a dozen. You're right. A dozen herbs that are associated with elevated blood pressure. Now, that doesn't mean these herbs are bad. They actually may have some useful benefits. Let me give you an example. Some of you see ginkgo. It's the fourth one down on the left-hand column. Ginkgo has documented benefits as far as improving brain blood flow, okay? So ginkgo has been used for centuries. Doesn't mean it's bad, but if you have high blood pressure, adding ginkgo may raise your blood pressure and get you into problems. Also, fourth down on the right side, you see senna. Senna is a common medication, quote, it's a plant compound, common supplement, better language, that is used for what? It's used for constipation. It's an irritant laxative. I don't like it for the way it works, because these are habit-forming laxatives, but it is effective. So you may have a senna-containing laxative that can raise blood pressure. You also see on this list the fifth item on the right, St. John's wort. That has documented benefits in treating depression. But again, if you have high blood pressure, this is probably not the best supplement to use for an antidepressant. Do you see how that works? So you can see a number of other things listed there. Ginseng, which has anti-diabetic effects, but also can raise blood pressure. You may have seen ephedra. That can have significant blood pressure-raising effects. I'll let you study the other items on there. Again, it doesn't mean they're bad, these supplements, but they can have undesirable effects in raising your blood pressure. Some years ago, I was doing a seminar, and all of a sudden, I mentioned one of the supplements on this list, and I heard an audible gasp from the back of the room. And the supplement I had mentioned was licorice. And it turned out one of the individuals in the room was using lots of licorice and was wondering about their high blood pressure. So keep these things in mind. Now, there are other macro and micronutrients that can be problems or benefits when it comes to blood pressure. So let's take a look at some of these. And this is kind of building on some things either that you've seen, questions that you've had, or things that are coming up. So let's look at a couple of micro and macronutrients. Now, you don't have these in your handouts, so don't be too worried. This is introducing you to some things that are coming up or we've already seen. So we've already talked about sodium, if you've been watching the videos. And we have a rule of thumb for sodium. If you take the milligrams of sodium per serving, and you divide it by the number of calories, less than 1 is the goal. Okay? In other words, put another way, you want to have more calories than milligrams of sodium per serving to be a relatively good choice when it comes to sodium content. Okay? So let's take an example. Let's say you buy a bag of corn chips. Okay? You following along with me? Corn chips. And let's say there's 150 calories per serving. How many milligrams of sodium might be in those corn chips? Could be a lot, may not be. Corn chips are surprising sometimes, may only be 100 milligrams of sodium. Some actual corn chips are not all that high in sodium, because the salt is on the surface, they taste saltier than something like, believe it or not, corn flakes. You know, the average corn flake usually has double or maybe even triple the amount of sodium per calorie as corn chips. Yeah, the corn flakes usually a much higher sodium choice. So you've got to look at labels. You can't always tell by taste. Grams of carbohydrate. This is coming up, and coming up this week, we're going to be talking about watching your sugar consumption. And this is an interesting one. If you look at total carbohydrates per serving and you divide it by sugar, that number should be 5 or larger. That means you're going to have relatively low amounts of sugar in relation to the total carbohydrates. Let's say you go into the store and you see natural granola, organic granola, and you say, wow, how could I get something healthier? Whole grain, organic granola. And you look at the ingredient list, it's very likely that you, instead of having 5 or 6 to 1, you may see 2 or 3 to 1. It's loaded with cane sugar and honey and other things, okay? So this is not a good choice as far as this program. You want to make these 2 things in your kind of sight finder as you're looking for the best foods that you can eat while you're on the program that we're following, okay? So here's how this works with hidden sugar. If you see, you look at the total carbohydrates, you look at the sugars. This is just a blow-up of an ingredient label. And you'll see here, you divide the total carbohydrates by the sugar. In this example, 24 divided by 3, you get 8. That's a good choice, if you were wondering. 5 or bigger is good. Now, to help you with good choice of carbohydrates, a lot of people say, well, carbs are bad. I have diabetes. Carbs are bad. It's not the carbs that are bad, okay? Many of your best food choices have significant amounts of carbohydrates. We've been talking about beans. Beans are actually a significant carbohydrate source as well as a significant protein source. So are your whole grains. So we've got some healthy grain recipes that are included in your handout. So I encourage you to try those. You're saying, well, boy, what can I eat? We've got a whole wheat herb bread. We've got a millet pudding. Okay? And if some of you say, wow, when I did the math on this, it seems like there's a little bit more sweetening than I want, well, you can cut down the sweetener a little bit if you want, if it's too sweet for you. But there are things that you can eat that have a sweeter taste that don't mean that you can't include them. Okay? Let me tell you about one other handout that you've got here. That is this healthy grain handout that I just showed you. And the reason I mention it is try to use some of the recipes, because we're trying to give you some things that give you some other healthy options as we go forward. Well, speaking of healthy options, I want to invite my wife to come on up. So Dr. Sonia DeRose joining us here. She's also a medical doctor, if you haven't been with us earlier. And Sonia, so glad that you're going to help me out here, because we've been talking about water so far this week in the program. We talked about water in and water out, okay? Water outside, this is a harder one for a lot of people to conceptualize, and you have some personal experience as a physician using what we call hydrotherapy. Can you tell us a little bit about some of the things that have excited you about water treatments?
Well, there are several very simple, basic water treatments that anyone can do in their home that are very helpful for various ailments. For instance, if you have a sore throat, you can do something called a heating compress. And it's a very simple thing. Take a little thin strip of maybe of thin cotton cloth like sheeting or a cotton handkerchief, wet it in cold water, wring it out so it's not dripping. Wrap that around your neck, and then follow that by a wider piece of saran wrap, overlapping so that it keeps the moisture in and doesn't let it dry out. And then over that, you put a wool scarf or a wool sock and pin it around there, and then and leave that on overnight. And
I mean, you are talented. I mean, Sonia's mic'd up, and I was wondering how she was going to do this without keep hitting her mic. But you did it somehow better than I would have. So you're right. So this heating compress is very effective as far as warding off a sore throat and all, and it's using water very simply, and you're not going to burn yourself, but it gives you a heating treatment, like Sonia said, overnight, because the saran wrap and the wool wrap over it, that is going to watch my mic too. That will actually keep you from getting chilled. If you just put something wet around your neck, right? That wouldn't be a good idea, but that's a great treatment.
The wool is important because in case the saran wrap slips or you don't wring it out quite well enough, which, by the way, is important to do. But if it slips off and something else gets wet, that's not a good thing, because wet on your skin at night, you get chilled. But wool is nice because it keeps you warm even if it does get wet. So that's the reason for the wool.
Great, great. Well, let's talk a little bit now about another hydrotherapy treatment, and this is one that is really, really very important to talk about, because we're speaking about 30 days to natural diabetes and high blood pressure control. And a lot of the patients that we have who have diabetes have neuropathy. First, tell us a little bit about what neuropathy is.
Well, neuropathy, neuro refers to nerves, obviously, and apathy refers to, a problem with it. It's not working right. With diabetes, it's very common, if it's not well controlled, to get something we call stocking glove neuropathy. Oftentimes, this usually starts in the feet and the toes, and then works its way up, and then it can get it in the fingers as well, because there's typically poorer circulation further away from the heart. And with diabetes, typically people have microvascular disease, so they're having, just like when you have someone who has cardiovascular disease, where you have atherosclerotic plaque in your arteries, that happens in the minuscule, tiny arteries all through your body as well. And then the other thing is high sugar levels in your blood actually cause, let me just take a little bit of time to explain this, because I think it's important. Your red blood cells, when everything is working properly, they actually, in order to get through the tiniest arteries in your body, which are called capillaries, those capillaries are so tiny that each red blood cell has to fold over on itself in order to get through. And it's designed that way on purpose, because that way there's maximum contact between the red blood cell wall and the capillary wall for transfer of oxygen and nutrients and waste products. But when your sugar in your blood is higher than normal, it actually makes your red blood cells stiffer, so they cannot bend properly to get through those the capillaries. And they've actually observed this on electron scanning microscopes in the back of your eye, where you can see it. And with a high sugar load, someone eating a lot of sugar, you can actually watch the red blood cells just backing up against each other when they're trying to get through the capillaries, because they can't fold over and get through properly. So if you have this chronically, it causes damage to your tissues and your nerves because of the high sugar levels.
So let's talk about hydrotherapy now. We're talking about water treatments outward. If some of you wondered about the graphic that we showed earlier, that was a sauna or a steam room. And that's one way of applying heat. But this is not what we're talking about for neuropathy. There's a special treatment that we've used probably between the two of us with hundreds of patients. Tell us a little bit about the hydrotherapy treatment we use for diabetic neuropathy, let's say affecting the calves and the feet.
So what you can have them do, I tell them, you just take 2 5-gallon buckets, you fill one with hot water and one with cold water. Literally have ice cubes floating in it, so it's really cold. One thing that's very important to remember, especially with people with diabetes with neuropathy, is they can't feel properly. So you have to have a thermometer. The water should not be over 104 degrees Fahrenheit, because they can put for the hot. The cold, it doesn't, I mean, it's fine to have ice cold water. That won't hurt anything. But they could stick their foot in a bucket of boiling water and may not feel it. So it's very, very important that you use a thermometer and have the water no more than 104 degrees Fahrenheit. And then you can put your feet in the 5-gallon bucket with the hot water for 3 minutes, and then transfer over into the ice cold water for about a minute, 30 seconds to a minute.
And how about 30 seconds?
30 seconds is probably good enough. Yeah.
Yeah, we don't want to get you discouraged before you get too into the treatment.
And then back to the hot for 3 minutes, the cold for 30 seconds or so, back and forth. So always start with hot, always end with cold. Do 3 to 5 cycles, and then dry off. What the contrast treatment is doing, the cold constricts blood vessels. So it helps, it pushes away the blood that's there, stagnant blood that's there, whatever. The hot dilates the blood vessels, so it encourages blood flow to come in to bring fresh blood, which is bringing oxygen, nutrients. The alternating, what it's doing is really stimulating the blood flow, so it's increasing the circulation to that area, and it's very effective.
Sonia, there's sure a lot of hydrotherapy strategies. You have some other points about this?
Well, I was just going to say, this is not something that you do one treatment and, oh, my neuropathy is gone. You know, it takes time, but I know when you worked at the Lifestyle Center of America there, they had amazing results with people getting symptomatic relief from the neuropathy, because neuropathy doesn't just necessarily eliminate any sensation of feeling. Oftentimes they have pain, burning, pain, numbness, tingling, pins and needles, it's miserable. So a lot of people were getting significant relief from that as well. Which medications, there are no medications that really do that well for neuropathy.
Yeah, I mean, we do have,
there's some things
somebody may be on like Lyrica or Neurontin, gabapentin.
That can kind of help calm down the symptoms, but it doesn't treat the problem.
Yep. Well, very good. So we've got a lot of options, hydrotherapy options. Hopefully this has expanded your list. There's more that we might be alluding to. There's more in the book, The Methuselah Factor, and other sources that you can check out. Sonia, thanks so much for sharing your expertise.
No, you're welcome.
Well, we want to just encourage you that all of these things can help you decrease your dependence on other things that may be undermining your success. So use some of these natural therapies, and they can be powerful. I want to go back to the color handout that you received or that you downloaded from the resources there under Session 3, Are There Shortcuts to Better Health? And we want to talk about some supplements that are of potential benefit. You're going to hear more about these things as we finish up the program. We are, if you're keeping track, right pretty much at the halfway point in the program. So although the 30-day program is about halfway through, this is our second to the last presentation because our final presentation will be next week. So we're trying to help you on the front end as you're following through the daily videos. So tonight, what kind of supplements do we want to focus on? We want to talk about magnesium. We had some questions that came through about magnesium. And those of you who have the handout or download it, you can look at some of the benefits of magnesium. Everything from having a role in smooth muscle relaxation and skeletal muscle relaxation for people with spasm problems, to influencing osteoporosis and diabetes risk. But we're focusing on it because it can help lower blood pressure. And how much magnesium does it take? We say it takes between 300 to 400 milligrams of elemental magnesium. Now, unfortunately, you could buy a magnesium supplement. It's not going to say how much elemental magnesium. I found when I'm working with patients, the insurers that I work with, and many of you know, even though I'm based here in Indiana right now, the telemedicine practice is still with an old practice that I was in for a number of years in California. So the insurers out there, they like to cover magnesium oxide. That's what we found. So we'll give prescriptions for, say, 500 milligrams of magnesium oxide, and that's going to be the equivalent of 300 milligrams of elemental magnesium. Some of you say, well, I've got all this milk of magnesia sitting in my home. Well, milk of magnesia is a natural source of magnesium, and it's got 500 milligrams of elemental magnesium per, do you see it there? Per tablespoon, okay? So now some people look on the milk of magnesia and they read the amount and they'll end up taking a laxative dose. The point is, if you get too much magnesium, it's going to clean you out, okay? Yeah, so just a warning. The other thing is, if you have kidney problems, you don't want to add magnesium, because one of the things that happens with kidney failure is you have difficulty eliminating things like potassium and magnesium, and it can be life-threatening. So if you have kidney issues, you should not be using magnesium. But other people, this is a safe and effective supplement and may even help if you have heart rhythm problems. I've seen patients who have their heart is skipping beats and things. They start taking magnesium, and the heart quiets down. Okay. Some of you asked about omega-3 fats, and we want to talk about those tonight. A lot of people hear omega-3 fat, they say fish fat. Well, hold on to that thought, but let me first tell you about some of the things that omega-3 fats can help with. There are links with heart events. The better omega-3 fat intake may have some heart protective effects. It can help you lower your triglycerides, which is a blood fat that can increase your risk of heart attack and stroke. Can help lower blood pressure, has anti-inflammatory effects as well. So when we're talking, someone asked a question to us this week about natural strategies for pain control. This is one of the natural strategies for pain control, the omega-3 fats. Now, here's the thing. Most people, like I said, they think omega-3 fats, they say fish. Well, the problem with fish is that fish are also very effective concentrators of toxins. Okay, you following along with me? So if you want to look for heavy metal contamination, fish is typically one of the leading sources in the American diet of, let's say, mercury exposure. So if you're concerned about your overall health, what we're saying in today's world, fish may not be your best choice. On top of that, if we were all on the planet getting sufficient amounts of omega-3 fat, if we were getting it from fish, the fish resources of the world would be depleted rapidly. Okay, you'd wipe out the fish population. So we can't all get our omega-3 fats from fish. You need to get your omega-3 fats, ideally. I say you need to if we want to have a sustainable program for the world, and you want to avoid the toxins, you need to get them from the same place the fish got the omega-3 fats from. Do you know that? Fish don't make omega-3 fat. Where do you think they get it from? That's right, they get it from eating plants and phytoplankton. Okay? So you can get omega-3 fats from plant sources. And I've included some details in your handout about some rich sources of omega-3 fats. There's a table in the handout. I'm not going to project. It is from our book, 30 Days to Natural Blood Pressure Control. And these things here on this slide that are also in your handout are summarized for you. Again, from our book, 30 Days to Natural Blood Pressure Control. Just putting those in your hands so you can see what would be some good choices. If you're really trying to maximize omega-3 fat intake, things like chia seeds, flaxseed oil, we prescribe this if you need high amounts, like as an anti-inflammatory dose, or you really want to take a significant amount of plant source for your blood pressure. Now, we talked about inflammation. Here's a person obviously with some knee problems. They've got someone wrapping them up with an ACE wrap. Well, what can you do to help your joints if you don't want to take prescription medications or other pharmaceutical agents? And in addition to the omega-3 fats, you may want to include turmeric, okay? We recommend starting with 500 milligrams 3 times a day. Boswellia, that is the same as biblical frankincense. And you can see there a Boswellia extract in the range of 200 to 600 milligrams twice a day also has natural anti-inflammatory effects, okay? Now remember, we're showing you this partly because of the questions you're giving us. Remember last week we said a lot of the common medicines used for inflammation do what? Raise blood pressure. Remember that? The non-steroidal anti-inflammatory drugs? The Nuprins and the Aleve, the ibuprofens, what do? They can raise your blood pressure 5, 10, 15 points. So if you can switch over to something like turmeric, Boswellia, omega-3 fats, these things either don't raise blood pressure or they lower it, as in the case of the omega-3 fats. Okay, we also have been getting a number of questions about sleep. Last week someone asked about sleep apnea, and we've been talking, some of you have been engaged with sleep topics this week because one of our goals was what? Sleep right. You remember that? What we're going to do in just a moment is we're going to show you a video. Let me tell you why I'm showing you this video. So in addition to the free videos that we have and the program that we're going through, 30 Days to Natural Diabetes and High Blood Pressure Control, we have an augmented version that was designed to go along with my book, The Methuselah Factor. And those of you who've been with us, you realize that the Methuselah Factor book uses the same 30 daily goals that you've been going through. And this just kind of expands the dialogue. So it's a great follow-up. It's something ancillary. And I know some people say, well, I'm doing all this. You keep talking about high blood pressure and diabetes, but I'm concerned about my mental performance. I'm concerned about my joint health. This book extends that whole dialogue. So we're going to show you tonight one of those videos, then take some more of your questions. So this is available on the website. You've got the link there, but we're going to show it to you tonight to give you a little feel for things that kind of augment the dialogue a bit for you. Welcome back to the Methuselah Factor, 30 Days to Better Health. I'm Dr. David DeRose. We're at day 11. Today's message, today's challenge, sleep right. As a radio host and as an author, I really have a lot of admiration for people who can just crystallize a powerful message in the title of a book. Some years ago, I had a guest on my radio show by the name of Sherry Calbaum. Sherry had just written a book called Sleep Away the Pounds. I mean, isn't that just a great title? I mean, doesn't that excite you that you could sleep away your weight problems? I just loved it. And whether you liked her book or not, I said, wow, if you could just capture something like that, that is a powerful message. Well, it actually introduces us to today's topic about sleeping right. Because not only was Sherry right in that better sleep is associated with weight loss, it is also associated with better blood fluidity. I want to tell you about some research that came from a researcher by the name of Phyllis Mullington. Phyllis is a PhD at Harvard. She did a review of the sleep loss literature, and she came out with a paper, Sleep Loss and Inflammation. She and her colleagues looked at all the things that happen when we don't get enough sleep. And they actually do. They worsen our blood fluidity, they raise levels of inflammation, and they worsen insulin resistance. So the message is, if you want to optimize your blood fluidity, you have got to get good quality sleep. Let me just give you a few illustrations of some of the things that get messed up if you don't get enough sleep. Tell you about some of the inflammatory compounds. Tumor necrosis factor alpha, interleukin-6, C-reactive protein. You say, well, wait, I mean, what is all this stuff? A lot of lay people have never even heard of interleukins or tumor necrosis factors. Here's why I'm telling you about them. Because if you've seen any kind of medical advertising on television, you have seen products that are advertised for rheumatoid arthritis or Crohn's disease or other inflammatory bowel conditions or asthma, other allergy-related conditions, autoimmune conditions. And many of these medications are working on these inflammatory compounds like interleukins and tumor necrosis factor alpha. Here's my point. You can spend thousands upon thousands of dollars on cutting-edge medications that affect these compounds, but you can also improve them simply by sleeping better. Frustrated? You've got insomnia? Let's talk about some pointers. In my book, The Methuselah Factor, I give a list of a number of factors. We talked about these in an earlier book as well, 30 Days to Natural Blood Pressure Control. They're so powerful, though. We call it sleep hygiene. I want to give you some of the keys that are often overlooked that can help you sleep better, longer, and more efficiently. The first one is get to bed early. That's right. The research indicates that getting to bed before midnight is better than staying up till after midnight. Sleep earlier in the night tends to be associated with better levels of melatonin and growth hormone, two natural body compounds that help to restore your body from the wear and tear of the day. If you will, think of them as anti-inflammatory compounds made by your own body. And what do? They help you with that overall picture of blood fluidity. Let me give you another point. Mentally prepare for sleep.
Too many people think, hey, it's bedtime, I can just jump into bed and fall asleep. It often doesn't work that easily. One of the worst things you can do before going to sleep is get your mind all agitated. Some people say, well, I can't go to sleep until I watch the evening news. Sometimes that's the very worst thing to watch. Don't try to balance your checkbook or two other strenuous mental activities. Well, you might say balancing the checkbook is fine if you got plenty of money and you just rejoice every time you do it with how much is still in your account. But if you're struggling with your finances, thinking about your problems, these are not the best things to focus your brain on. Let me take it one step further. If you're laying in bed and you can't sleep, then refocus your brain. In the old days, I used to recommend a sleep tape. When I mention this to younger patients today, they say, a sleep tape? What are you talking about? Okay, a sleep audio recording, an MP3 recording. Someone's voice saying something that's familiar but engaging. Perhaps you're going to listen to an audio of these very presentations. Listen while you're sleeping. You heard days 1 through 10 already. You're going to listen to them again while you're sleeping. It's just going to refocus your brain on some things that hopefully are engaging but not stimulating. There's something else, though, that can help you to sleep more efficiently. It's avoiding certain things. Now, you may have gathered, based on what we've talked about up till this point in the program, that caffeinated beverages are things we're trying to help you put away, trying to use less of. But for many people, caffeine after lunchtime, even just in the midday hours, can undermine sleep quality. Even earlier in the day, caffeine can undermine quality sleep by lowering melatonin levels. So melatonin, this natural sleep-enhancing compound, if you take caffeinated beverages even before noon, for some of you, that's going to blunt your melatonin production. Well, I'm talking about something that's negative. Let me tell you something positive. If you want to boost melatonin production and boost your sleep, prioritize bright light exposure early in the day. This morning, I was out around dawn getting physical activity. Exercise outdoors early in the day, powerful. That bright light exposure helps you to fall asleep at night. But now here's what's really interesting. If you go out late in the day, shortly before sundown, get some physical activity outdoors, that will help you sleep through the night. So bright light exposure late in the day helps you not wake up in the middle of the night, but sleep through the night. Well, hopefully those pointers give you some more direction as to how to sleep better. But whatever you do, make a priority of getting the sleep you need. It's one of the keys to optimizing your blood fluidity, improving your Methuselah factor, and that's what this journey is all about. I'm Dr. David DeRose.
So can you see why we thought that fit in with what we were talking about tonight as far as things that are anti-inflammatory? Good sleep, quality sleep can be one of those things that can help you with inflammatory conditions. So let me tell you, if we didn't mention this already, we have special pricing on those resources. They're half price, the digital download of that 30-day series. So this is the extended series for the Methuselah Factor. Let me tell you what I'm trying to work on. I'll let you know next week whether we pulled it off. We're trying to get these free for all of you if you've gone through the 30-day program and you do an evaluation, okay? So we're trying to work this out. I'm working with our tech folks, not here at this venue, but who work with Compass Health, which is the publisher of the books. So we're trying to pull that off. But best thing we can do, we know these resources are at least half price on the digital download, normally $19.95. It's $9.95 through the end of November of 2021. So those are out there. Hopefully we can get them to you free as well for those of you who've been going through the program, okay? So more about that next week. And if I forget, make sure you remind me because next week is our final presentation. Having said that, we want to move on to talk about some other things that you've wondered about. We had a question last week about sleep apnea. Just a single graphic from our book, 30 Days to Natural Blood Pressure Control. We've put this in your handout, and this is just making a connection. If you have untreated sleep apnea, it dramatically increases your risk of high blood pressure. In fact, it does tend to raise your blood pressure in and of itself. So if you have undiagnosed or untreated sleep apnea, if you're falling asleep at inappropriate times, for example, if you're in this stimulating lecture and you're falling asleep, or you notice the person next to you snoring, okay, please just nudge them and say, see your doctor, get a sleep study, because you may have sleep apnea. Okay, we've done some other things for you. You've seen these secrets to better sleep. I don't want to spend time with them. I highlighted them in that video, but you've got the whole list originally found in the book 30 Days to Natural Blood Pressure Control. That's in your handouts from last week. If some of you downloaded that, you said, Dr. DeRose, 2 of those pages were the same. We've fixed that, okay? So if you have the handout from last week, go to the website. We've got it upgraded. Somehow we got the same page twice in the handout materials, and you missed the 3rd page. So you've got all these different things that you can do naturally to improve your sleep quality. Okay? On that note, we want to move to some other live questions, things that have been coming in this week, things that are coming in right now. So, ladies, what do we have coming in?
Dr. DeRose, they would like to know, one of our plan participants, she says, I have neuropathy, but I'm not diabetic. Why would this hydrotherapy still help me?
Okay, so the question is diabetic? No. Neuropathy? Yes. Can you have neuropathy for other reasons? No question. And we do use the contrast treatments in other conditions. Here's a surprising one. Many people who do not meet the criteria for diabetes, they actually have prediabetes, they can have diabetic neuropathy. So there's not a magic point. Once you get to a fasting blood sugar of 126, we say now you have diabetes. Well, when your blood sugar was 124, it didn't mean that wasn't damaging your nerves. So we do find many people with prediabetes can have neuropathy. There's other causes of neuropathy too, toxic neuropathies and other things. So we recommend giving a trial to the hydrotherapy. Many of the times it can be effective. What about other questions?
We have several. Are there symptoms of blood pressure or blood sugar issues, or is the only way to know by being tested by your physician?
Okay, so question is about symptoms. High blood pressure and diabetes. Usually symptoms only occur when the problems are well advanced, okay? So in other words, you could be walking around with a blood sugar of 160, fasting blood sugar, get up in the morning. That's way above the diabetic threshold, and you may not even be aware of it. Many people have high blood pressure and are unaware of it. They can be walking around with a blood pressure of 200 over 100, not be even aware of it. Now, sometimes they will have headaches with high blood pressure. And if your blood sugar, especially when it gets to above 160, higher sugars, the higher it gets, it really becomes a problem. And let me tell you why. Your kidney can hold sugar to a certain extent, but once that blood sugar gets to be about 160, above that, it can't hold the sugar, and the sugar starts spilling out in your urine. And when the sugar spills out in your urine, it has a diuretic effect, so it pulls water with it. So when you have uncontrolled diabetes with high blood sugars, 200, 250, and you get into that range, you'll often start seeing 3 things. You'll have more urination, okay? So we call that polyuria. You're urinating more because the high sugar going through the kidneys, pulling water with it, you're urinating more. What happens then if you're urinating more? Well, you're getting thirsty more, okay? So you have polyuria, and we call it polydipsia. That means your thirst increases. And if the sugar is going out in your urine, it's not getting into your cells. And you can actually, on a cellular level, you can be starving when all this sugar is going out in your urine. And so you have polyphagia. You have increased appetite. So someone says, boy, I'm eating more than I ever have, and I'm losing weight. This is so great because I'm overweight. I wanted to lose weight. No, this is not so great. Your blood sugar is 350, okay? And you're exposing your body to these toxic high blood sugars, damaging your nerves, damaging your kidneys, damaging your eyes, okay? So don't wait until you have symptoms. Check, be proactive. If you have any questions, get your blood sugar, your blood pressure checked, and keep following up on it. What other questions do we have?
Okay, this is concerning blood pressure. This gentleman asked, my blood pressure is at home runs 130 over 72, but when I go to the pain clinic, it shoots up to 180 over 108. What causes that, and what can he do?
Okay, we used to call it white coat hypertension, but now most of us doctors, at least in the venue where I worked, we didn't wear white coats. So, but it's when you get to the doctor's office, it's often that way. Many people, we see this, that their blood pressures run higher than they ever run at home. And the danger is that you'll get over-treated, okay? So the doctor puts you on all this medicine, and when you're at home, you're 130 over 80. Now if they give you blood pressure medicines to get you down from 180, well, you may be 80 or 90 at home, systolic, and you may be getting lightheaded. You could even pass out. So we always like to do what we call ambulatory blood pressures when you're at home. Check your own pressures. Bring your cuff to the doctor's office. Bring it to the pain clinic and compare with your cuff and the cuff that the doctor uses. If your cuff says 130 over 80 at the pain clinic and they say 180 over 100, the problem is not that your blood pressure goes up at the pain clinic. The problem is you've got a bad blood pressure cuff, okay? So let's just make sure that's not the problem. Okay, what else do we have?
Okay, so could you please recommend the best times during the day to test your blood pressure? This gentleman tested, and he was at 140 over 80 after a noon meal, but 110 over 60 later in the afternoon and before bed. Does blood pressure rise after eating?
Okay, so there's all kinds of things that can affect blood pressure. So we recommend if you have high blood pressure and you're on this program that you check your blood pressure 3 times a day. There's a number of reasons why pressure can vary. Let me give you one. Medications. Depending on what time of day you take the medications can affect what your blood pressure is. Some people tend to have their highest blood pressure reading of the day early in the morning. There are certain stress-related hormones that are high in the morning. Your blood pressure can be very high. Other people are very susceptible to the stresses of the day. Their blood pressure goes higher as the day progresses. And it's important to know that variation in blood pressure. When it comes to meals, meals tend to stimulate what we call the parasympathetic nervous system. And for many people, it's relaxing and blood pressure lowering, but depending on what you eat and other factors surrounding your mealtime, that can affect your blood pressure one way or the other also. So yes, it's important. Frequent blood pressure checks, I recommend at least 3 times a day. And if it's vastly different, talk with your provider. Sometimes we have to split medications up. For example, if you're taking your medicines at night and your blood pressure is great in the morning, but before the next evening dose your blood pressure is high, maybe you need to cut that medicine in half and split it up rather than just taking it once a day. And ultimately, we're trying to help you get off those medicines, but we want to keep your blood pressure as stable as possible as we're on that journey. What else do we have?
Okay, if giving up sugar, can you substitute honey or stevia in place of sugar?
Okay. So when we're going to be focusing more on sugar intake this week as you go through the program. I think it is day 17. And again, whether you've got your printout, your sheet there that has the goals, yes. So day 17, avoid hidden sugars. That's coming up in just a few days. The focus there is all sources of concentrated sweeteners. And among those sources would be honey, would be molasses, okay? Now it's true honey and molasses have a little bit more in the way of nutrients than white refined sugar, but we recommend that you try to get away from all of these concentrated sweeteners. Now stevia is different. That is a natural sweetener, and that I feel much more comfortable with. It will not tend to have those negative effects that the other concentrated sweeteners have, okay?
Okay, we have several bean questions here for you. When you say be big on beans, should we be avoiding canned beans and concentrating on home-prepared beans? Are canned beans okay?
Okay, so canned beans. Canned beans are definitely a way to get beans. And if it's the only way you can get them, it's better than not eating them at all. We do recommend, if you have high blood pressure, that you soak those beans overnight. Get the sodium out of them, as much sodium as you can, and pour that water off, because often the canned beans are very high in sodium. But it's a reasonable source of beans. But it definitely is a better option, and they taste a whole lot better. You can cook them more thoroughly. I have problems with digesting the canned beans, but I don't when we cook the beans at home. Okay?
We talked about the supplements to avoid, but what are the best vitamin supplements to get if they can't get them through their food?
Okay, so we've talked about some supplements tonight that would be beneficial, like magnesium and omega-3 fats. There are other things in our book, 30 Days to Natural Blood Pressure Control. Chapter 12 goes through a whole list of natural supplements that can help with blood pressure. We mentioned things like coenzyme Q10 and L-arginine. We mentioned hibiscus tea. So there are a number of natural things that can help. In the area of diabetes, if you just have diabetes and don't have high blood pressure, ginseng that we mentioned, actually certain of in the ginseng family actually have blood sugar lowering effects, but can raise blood pressure. So you got to watch that one. An interesting one that we've used a lot of, a natural supplement, is guar gum and psyllium seed husks. So soluble fibers can help to stabilize blood sugar. So we'd have people take these before meals, and it helps to blunt the rise in blood sugar after meal. By the way, beans do something similar. Okay? Now, just for the record, for those of you that are in the house and have questions, we need you writing those down. I think we have an usher in back who's, or maybe Thomas could help us too, or if you have questions, and just bring them up to our ladies here. So I know we're getting a lot of these questions. Some have come through tonight, others have come through during the week. Remember, if you're watching the daily videos and you get the texts, there's an option where you can send questions through to us, and we'll give preference to answering those next week. But go ahead, what else have we got?
Okay, this lady is asking, she says that she's constantly cold with a cold nose, hands, and feet. It's been debilitating to be cold and feel chilled both inside and out, and have to sit right next to blowing heat all day. It's not an issue of thyroid issue, but poor circulation, which is serious. Can you please suggest what to do besides more aerobic or intense exercise?
Okay, so the question has to do with poor circulation, okay? Cold hands, cold feet. And I told you the other night, and maybe this is why the question is coming up, and that is one of the things that you're at risk for if you have lower blood pressure is cold hands and cold feet. Remember, and I told you it was better to have cold hands and cold feet than heart attacks, strokes, blindness, kidney damage, right? So but still, if you've got cold hands and cold feet, that's not fun either, especially as it gets colder out, right? So you can say, what do we do to help? Definitely, as the questioner identified, doing more physical activity can be beneficial. Let me tell you about two other things that are very important when it comes to circulation. One is avoiding caffeine. Caffeine is a vasoconstrictor. That means it tightens blood vessels. Another common vasoconstrictor to avoid is nicotine. Nicotine is also a vasoconstrictor. It's also important to be well hydrated, because if you're not well hydrated, the way your body maintains your blood pressure is by constricting blood vessels. If your blood vessels tighten up in your feet and hands, yes, it will maintain your blood pressure, but it will also make your hands and feet colder. Okay?
And then our final question is, what are your thoughts on taking systemic enzymes? One particular doctor states that after the age of 27 to 35, they drop off, and you need to replenish them through supplementation. Okay.
So an interesting question. So if we measure physiologic processes, things do tend to change over time. The question always becomes, do we need to replace things that change over time? And most of the time we don't. That's what the medical consensus is. Things do tend to decrease, but there's a great experiment in the 80s and 90s where they were giving every woman, when they went through the change, female hormones. This did not result in benefits, it resulted in liabilities. And I know there's all kinds of discussion about that, but generally we want to be careful about not just coming to a conclusion if levels of something are coming down, it's better to raise them up. Sure, if you have digestive problems, definitely, maybe you have an issue with the pancreas not producing enough enzymes. In my experience as a physician, this is not a major problem. The major problems are lifestyle related, and when we change lifestyle, digestion tends to improve. We may have a few more questions coming in our final minutes, but I do want to touch on a few things before we finish, and that has to do with this here, daily rest and weekly rest. So this week and tonight, we spent a fair amount of time speaking about sleep and how to sleep better. But it's not only important to get daily rest, weekly rest is also important. Tonight, I told you this last week, we're going to do something special in this venue. So if you've been coming here to this venue, we're going to be showing the third in a series of meetings called Panorama of Prophecy. What we're doing is we're airing this on a little bit different schedule than it's taking place right now live from Northern California with Pastor Doug Batchelor. But we've been showing the meetings here, Panorama of Prophecy, and we're doing some exciting things right in this venue. So if you stay by, we're having a double feature tonight. Okay? So in this venue. And by the way, if you're watching online virtually and you haven't heard about this program, just come back to the fortwayneadventist.org website and you can click on the link. It'll be a separate link. It will not be the same link for this presentation. And we're going to show the third in the Panorama of Prophecy series. I think it's an especially great one. I alluded to this last night, at least our last meeting a week ago. And the reason why is it's speaking about this topic of theodicy. It's this whole question of, how can there be a good God and yet there be evil in the world? How can bad things happen if there is a loving Heavenly Father? So that is the topic of the presentation tonight. We've honed things down from the Panorama of Prophecy meetings, so they pretty much fit into an hour. So we'll have a second 1-hour feature tonight in this venue. Like I said, you're welcome to stay on with us, or you can go to panoramaofprophecy.com. We'll be watching episode number 3 tonight together here in this venue. So I really encourage you to go through that series, whether you're doing it with us here in this venue. You say, well, why would I come to a church? That's where we're filming this. You say, why would I come to a church when I can just watch at home? I can go to panoramaofprophecy.com and watch it at home. Because here, we're giving you the full color handouts. We're going to have another drawing tonight with some special book gifts that we're giving out each night. A number of you have gotten some. We're going to give out a health book tonight, as well as a book, actually, Pastor Doug's testimony, The Richest Caveman. So we're going to be giving out a couple of books this evening. The other thing that we have on selected evenings, we won't do it tonight because of the double feature, but we actually have our own interactive time, our own question and answer time as far as some of these Bible themes. So I think it's a great venue. Now, some of you are listening and say, well, wait a minute. Dr. DeRose, we're watching this health series, 30 Days to Natural Diabetes and High Blood Pressure Control. Why are you, including this Panorama of Prophecy? Why would you want to include that in this series? Remember, every 7th day in this program, we're encouraging people to focus on weekly rest. Rest and refresh is what we called it the first week. And then we've been sharing with you today, if you've been going through the program, about seek spirituality. Now you say, well, why would you want to put something from the Bible? After all, a lot of people I've met over the years, they've said, I grew up in a church and it was nothing but problems. Or the church did this bad thing to me. Or my family had these problems with a church. Or people in church are this or that. Here's the thing. Here's what I've noticed. And remember, this is coming from someone who I think I mentioned to you in our last session was an agnostic. I have actually found some compelling answers in a correct understanding of what we call the ancient scriptures. And I think Pastor Doug Batchelor has done a great job of making things practical, that if you're willing to take another look at maybe some things that turned you off in the past, because they turned me off too, I'm with you, I'd encourage you to stay by tonight for that presentation or catch it at panoramaofprophecy.com. We got a few minutes left. Any last questions come in for us tonight?
There is. Where can they get a copy of the recipes they're very interested in? Okay, so copies of the recipes. So again, the place you want to go if you want to get copies of everything is this fortwayneadventist.org/30 days. Every week, each of these weekly sessions, we've been including recipes. So if you want the healthy grain recipes, go to fortwayneadventist.org/30 days. Now remember, I tried to walk you through this earlier in this presentation. Scroll down past the featured presentation. That would be tonight's presentation. It'll probably be first when you open that landing page. Then you'll see the films, the roughly 6-minute videos that we have each day for you. And then go further down and you'll see there each weekly session, the handouts. Be sure to download those. We've put a lot of things. The publisher, Compass Health Consulting, has been gracious in allowing us to reproduce a number of the graphics from my books, The Methuselah Factor and 30 Days to Natural Blood Pressure Control. Now it's true, between those two books, I think there's probably 120, 130 illustrations, so you're not going to get them all, but we're putting a number of the pertinent ones in your hands to help you on your journey. Well, thank you so much, ladies, for fielding the questions for us tonight. Thank you, each one, for contributing questions to us. And I want to encourage you to be doing these things that are on our program mechanics list between now and our final time together next week.
And that is, if you've been making these changes, keep your medical providers in the loop, okay? Please do that. Track your progress. One of you came up to me this evening and you showed me some great things that you've been keeping track of, your blood sugars, your blood pressure, and watch those daily videos. On that note, I want to wish each of you continued success as we continue 30 days to natural diabetes and high blood pressure control.